Hello, everyone. A very good evening, ladies and gentlemen. I'm Dr. Vinay Purohit from Medical Affairs team of Lupin. Lupin, which is one among top 5 biopharmaceutical organizations of India. On behalf of entire Lupin team, I would like to extend a warm welcome to all. We really appreciate you for taking the time to join us today for the first talk on the Guardian series featuring the role of a guardian for every epileptic patient. We all know everyone who is suffering from epilepsy always needs a guardian by their side. The care and support provided by a guardian is invaluable for a person suffering from epilepsy. Today's interactive session will be featuring the life journey of a well known cricketer, Robin Uthappa, and his untold story about his guardian. As a batsman, Robin has always been attractive to watch, hard hitter, and unafraid to hit the ball in the air. He was a part of the Indian squad which won World 2020 in 2007. Putting in a stirring performance, Uthappa shone in his role as an opener, bagging the orange cap with 660 runs, which included a record-breaking sequence of 1140 plus score. It was his consistency that helped KKR bag the coveted trophy for the second time. He has a record of longest six in IPL 2110, 120 meters. Welcome, Robin. We
Thank
also have
you.
on board a distinguished neurologist, Dr. Sumit Singh. Dr. Sumit Singh counted among one of the most famed and experienced neurologists in India. Dr. Singh, who is currently the director at Artemis Hospital, Gurgaon, has been a topper in DM neurology from AIMS. With a thriving experience of over 20 years, he has been instrumental in starting the first headache clinic in India and neuromuscular disorder clinic in North India at AIMS. He is a great teacher, prolific speaker, and researcher with more than 124 publications in peer reviewed journals and 14 chapters in books. He has also
24.
served as 24 chapters in books. Thank you, sir.
Wow.
He has also served as additional director of neurology at Medanta Hospital. He's an active member of various neurological societies of India, such as Indian Academy of Neurology, Delhi Neurological Association, International Headache Society, Movement Disorder Society, etc. It's a very different occasion, folks, as at one end, we have a well-known cricketer, Robin Uthappa, and on the other hand, a distinguished neurologist, Dr. Singh. Today's talk will feature real-life experiences from Robin as well as clinical experiences from Dr. Singh. The common factor in both these experiences is a disease called epilepsy. So my first question for today is to Robin. What is the first thing that comes to your mind when you hear word epilepsy, Robin?
The first thing that comes to my mind is the fact that I went through it. I remember the experiences. I remember when it happened for the first time. And I remember how I felt, a little helpless, a little lost, some blankness of, some space and time as to not knowing what happened. Uh, at a certain point, and then suddenly I regained consciousness, and I just felt like time had passed by. So those are the experiences. But there were times I could even experience physically what was happening to me, but I just couldn't control things. And I'm very grateful that I had my mother as my guardian at that point in time, who really helped me and through all of it. And she was there for me through the whole process. So I'm extremely grateful for her for the role that she played in my life at that point in time.
Dr. Subit Singh, from the doctor's perspective, what exactly is epilepsy and what causes it?
Okay, so epilepsy is basically a short circuit in the brain, if you want to put it into a word for a layman. So in our brain, there are about 3 trillion cells, and we need only 3 of them or 4 of them to go awkward and misbehave. And that is what sends shock impulses of electricity in the brain, which manifests externally as, jerky movements of the extremities, patients falling down, froth coming out from the mouth, tongue bite. People lose their control on their bladder. They tend to urinate and defecate in their clothes. They can injure themselves. There are several types of epilepsies, and it is not necessary that every patient would have these dramatic, these violent, jerky movements. There could be people who would just have a minor loss of conscious contact with the environment, and that is all which they would be experiencing. So Epilepsy has hundreds and hundreds of causes, hundreds and hundreds of types, but the commonest ones would be some of them which are primary generalized epilepsies, which are genetic in origin. And then you have epilepsies which are because of some problems in the brain, like sometimes there can be a worm which can manifest and go inside the brain. There can be tumors in the brain, there can be infections in the brain, there can be small strokes in the brain which can cause epilepsy. So many causes, but the basic reason is a short circuit in the brain which causes a sort of a blackout. That's what happens.
Thank you, sir. Robin, tell us more about your journey as a patient suffering from epilepsy.
I must have been around 10 or 11 when I first had the experience of it. I remember I just finished school practice and I was waiting for my mom to come and pick me up. She came and picked me up on her bike, and then we went back home, and I was feeling pretty tired when I came back home. And I just lay down on the couch. I remember I put my kick bag in my bags aside, and I lay down on the couch, and just I felt something going off. I think in my head, and I just started. I began to feel a little weird in my head, and all of a sudden I called for my mom, and as I called for her, I felt it come on, and then the first time I don't remember what happened. Like Dr. Singh said, it was a little bit of a blackout. I don't remember what happened in that time. All I remember is when I came back to consciousness about 5 or 10 minutes later, my mom was crying. She was in panic. She didn't know what was happening with me, and she was extremely worried and concerned. And the first thing she did was she literally tied me to her on the back of with her dupatta onto her back, and she took me on her bike to my pediatrist. So we went straight there because he's someone who's looked after me today is my son's doctor as well. So there's a lot of faith that goes back on him. So we went to him immediately, and the first thing he did was actually consoled my mother, told her not to worry. And then he said, let's see what it is. And as in I was 11 years old, so I don't really remember what conversation they had. But I remember that he consoled her, and then he said, go back home. And he just told her that in case you see or he calls for help, just put a key or a key bunch in his hand. So my mom always had her almara keys in handy with her, always close to me. So that was one thing that immediately came into play. Subsequently, after that, I had a few more attacks. In fact, we were going out on a family outing with my mom, my dad, my sister, and we were just going to go out. And I know we were going to a restaurant for a meal or something. And then on the way, I had the attack. And again, panic ensued, and they didn't know what to do. And we drove back to the doctor again, and he said, "Okay, now let's since this is actually beginning to happen a little often, let's just go to a neurologist." And then they put us on to a neurologist, and then we went there, did a lot of checkups, ECGs, and like I remember doing that multiple times as a young kid. And this was I'm talking about 94, 95, 96. So I think at a very early nascent stage in India for these aspects, I think something I didn't hear about. I think back then epilepsy wasn't heard about. I think people would say he's getting fits. That's what was said, and then we were educated that epilepsy is very different from fits and those seizures, and we were educated like how Dr. Singh just enlightened us a little while ago. Mine wasn't as bad as possibly defecating or urinating in my pants. I had violent movements of my tongue and my lips to one side, and a fluttering of my eyes, and just shaking of my whole face and my body being tight, my fingers getting tight, those kind of stuff. And then got on a medication pretty soon after the ECGs, and I took those medications for a good 2.5 3 years, um, which I also believe in on some level kind of had an impact on my growth. Because being exposed to steroids at a very young age, at pre-teen age, I think had an impact on, how tall I grew as a person. Even today, I feel like my limbs are longer than my torso. Um, I feel like it possibly just slowed down my metabolism because I was till the age of 11 or 12, I was considered a pretty tall kid, and suddenly I wouldn't grow till the age of 16. Like literally, growth stopped for me. And my father and my mom are pretty tall people, so somewhere in my head, I feel like possibly even affected in my growth as a child.
Thanks, thanks,
I
Robin,
could
for
be
sharing.
wrong, but yeah, that's what I feel.
Mhm.
Dr. Singh, is epilepsy still a taboo in India? What can we do to overcome this stigma, myths, and taboo surrounding epilepsy?
Unfortunately, it is, and not so much for the males, but for the females, it is
Mm.
still a problem because I actually did a study when I was in AIMS to look at the social aspects of epilepsy in patients who had chronic epilepsy, and I found that more than 40% of people were depressed, more than 40% of people had significant anxiety, and almost all of them had faced some sort of social problems, whether it was discrimination in their job, whether it was less valued job and they got it because they had epilepsy, so they couldn't get the job they wanted to. They could not work in night shifts. They had difficulty in getting married. They had problems with their spouses because many times people got married after not telling their spouses before marriage, and then you have a seizure after the marriage, and then the spouse comes to know that this guy or this lady has epilepsy, and therefore these social problems were found in practically all the people we studied. So yes, taboo, it is still considered. Unfortunately, people not only think that it's a disease which is sort of incurable, they also think that it is communicable. They feel that eating with the patient with epilepsy, sitting and shaking hands with a person with epilepsy is possibly going to transmit the disease to them. So that is the level of taboo and the misconceptions which people have in their minds. They don't even think that epilepsy is disease like any other disease, and it can be treated like any other disease. Unfortunate but true.
Thank you, sir. Robin, how did you manage to cope up with these difficult times?
Like I said, I think I have to give a lot of credit to my mother, and I'm eternally grateful for her support at that point in time. My mother was a very strict mom growing up, but I could tell that in that time, seeing how helpless I was, I received a lot of empathy from her, and I think which is extremely important. Just touching upon what Dr. Singh just spoke about, I think there needs to be a level of ownership about something that we go through medically or clinically, whether it's depression, whether it's epilepsy, or anything that we consider taboo in our country. I think as a patient, if I have a sense of ownership about it, because this is something that's not my fault. Mine was predisposed to genetic. I was predisposed to genetically because when we went back to the family tree, we realized my cousin had it at a very young age when he was an infant. My oldest cousin had from my mother's side had it from a very young age when he was an infant. So it possibly came, genetically. So it's no fault of mine. So for me, I never felt ashamed of the fact that I had epilepsy. In fact, I took ownership of it, and I didn't allow judgment of exterior judgment of the illness in any way affect me as a human being. As a young kid, I was extremely strong and I was extremely, I was aggressive as a batsman. So a lot of people even, said that, he's taking steroids as a child because of epilepsy, and that's why he's able to hit the sixes he's able to hit. You know, that's the level, that's the kind of stuff even I heard, but I never let that affect me. Because you understand, if you make the effort to try and understand what it is, sometimes it's some things become taboo because there's a fear of it, and there is fear because there is a lack of knowledge of something. Fear roots from the lack of knowledge of something. When you have knowledge of something, the chances of you fearing it are a lot less, automatically becomes a lot less. So it's about actually making the effort as a human being to understand it, understand what the situation is, so that you don't have to fear it. And it's not life threatening. It doesn't spread by touch. Even AIDS, for that matter, the kind of reputation that it had before awareness was created for it, was that it could spread by touch, which is so uncalled for, right? As in, if people just did some research and just took the interest to find out what things are about, what these things are about, there wouldn't be a reason to fear. People like Mother Teresa and Princess Diana, who kind of burst those bubbles for us, and today there's no fear of them. It's not looked at as there's no judgment on that disease, so to speak, right? So similarly, I think it's about gaining that knowledge. And for me, I think as a kid, because I had cricket as an avenue of expression for me. I never let this affect me negatively, and I have to give credit to my family as well. My mother and father, my sister, didn't allow me to affect it. They in fact paid attention to me in that period, especially my mom and my dad, but more my mother. My mother really paid a lot of attention to me in that time. She's very particular that I had my medication, didn't miss my medication. She was particular about me carrying something that I could feel that was cold in my hands at all times. So in case something's happened, I just had to grab hold of it. But luckily for me, by God's grace, I never had anything when I wasn't with my family. All my attacks happened when I was with my family. So in that
It's
way, I
very
consider
inspiring
myself,
story.
yeah, I consider
Absolutely.
myself, blessed and lucky to have actually gone through this experience, when I had my support around. But I have to say that, my mother in that period supported me a lot. There was a lot of empathy from her. And I don't know if she got the kind of support that she needed to be the guardian that she was. I haven't had a conversation with her about it, but I truly feel that a guardian also needs the support that they provide to the patient. They
Absolutely.
need that back end support so that they're able to provide the kind of support that the patient also needs.
Absolutely.
Thanks, Robin, for sharing such an inspiring story. Dr. Singh, our audience, they want to get your advice. What is the role of guardian for epileptic patients, and what are the expectations of patients with epilepsy from their guardians?
Very, very important question. So, the role of the guardian, firstly, is to ensure that epilepsy is given the due care. It is also to ensure that the medical attention which the patient requires should be given to them as soon as it's possible. To understand that this is a disease, it is not some atma, this is not some ghost, this is not some witchcraft in your body. Go to treatments, not go to superstitions. Go to doctors, not to tantrics and babas, to ensure that you take treatment and not use different types of shoes to put over the mouth so that you can smell it when you are having a seizure. To understand what exactly is to be done at the time when a seizure is happening. Not that when a seizure is happening, one should be understanding that the patient has to be turned to one side, nothing is to be put in the mouth, don't try to stop the seizures. So all these things are the role of a guardian. And also to understand that adequate investigations should be done. A doctor who understands epilepsy should be seeing the patient. Understand that if the drugs are not being controlled, the epilepsy is not being controlled, and then one has to take the expertise of an epileptologist, because neurology is now evolving into a subspecialty branch where people would be looking at epilepsy only. They would be looking at headaches only. They would be looking at Parkinson's disease only. So if there would be about 10% of patients with epilepsy who would not be controlled with a single drug or multiple drugs and would require sometimes even surgery. So it is not that you can give up and go to quacks and non doctors for taking the treatment of epilepsy. That is the role of a guardian. And getting adequate investigations done, adequate treatment done, and the compliance part. Many times the seizures and the epilepsy is not controlled because the treatment is not taken adequately and not taken in time. The patients, they miss their drugs, they don't take drugs in time, and that is why there's breakthrough seizures happen and epilepsy becomes even more difficult to control. So, similarly, it is the role of the guardians as well as the patients to ensure that the medicines are given adequately and they are given in time. There is no shortage. Many times people say, "Oh my God, I finished my stock of medicines. I couldn't buy it, so I did not have it for 2 days." Now, you don't live without eating for 2 days. Why do you live 2 days without taking the medicines? So
Right.
the availability of the medicines has to be ensured. They have to be given in time. That is the role of the guardian, and the expectations of the patients from their guardians is basically to have a non-discriminatory approach towards that particular child or person from the other siblings. So you don't have to give an extra care to that child, but you have to have a watchful expectancy. You keep on observing things, how they're going, but it's not that you give them an over caring and over protection type of a thing. I'm sure, Robin, when you must have started playing cricket, if your parents wouldn't have supported you the way they did, you wouldn't have been here where you are. If they would have
Oh,
said that, "Oh my
absolutely.
God, you'll be playing cricket and cricket ball is a hard ball, it can hit you when you have a seizure," there was no way they could have reached to the level which they have. So,
Oh, absolutely.
yeah, so
Uh,
the siblings should be treated equally. The one with epilepsy should be cared for more, but it should not be an overprotective type of an approach. That is what the kids, the patients with epilepsy, they expect from their guardians.
Thank you, sir. Caring for someone with uncontrolled epilepsy can be like living a constant state of tension. Robin, you shared your experience about your mother as well. How did your guardian cope up with this stress in her routine life?
I think Robin has got disconnected, I think.
So, Dr. Singh would like to ask you another question. How
Mhm.
do guardians
Sorry,
of epileptic patients
Feedback,
manage
feedback.
to cope up?
I
Yeah,
apologize. Something just happened. I apologize.
He's
no
got
worries, Robin.
feedback.
So, okay, can I
So,
just touch back on what Dr. Singh just mentioned? I think I can think back of a time which I was just relating when Dr. Singh was sharing that there doesn't need to be extra care. And I just remembered a funny incident that happened when I was going through this, and how he said, you shouldn't miss medication at all, and if you don't miss a meal, how can you miss medication? And in after start beginning my medication for after about a year or so of taking the medication, I happened to be at my pediatrician's house and I was playing with his children at their house, and I had forgotten to carry my medication for the afternoon, my afternoon dose, and I came back post lunch and I hadn't taken it. So I'd come back home at about 3:30, 4 o'clock. And I got such a beating from my mother for missing that dose. I will never forget that beating I got from her, because I could see how frustrated she was, right? Because, she's like a guardian's constantly caring for you and trying to stay on top of, not taking or making sure you take your medication and being there for you and, being watchful. But, and that's why I said, the kind of support that a guardian also needs in a situation like this is also critical, because at that point there were no mobile phones or anything to get that communication down to me, or she didn't know if I actually had carried the medication with me or not. That's a very funny incident. When I think back of it, I got a nice beating for it, but it just made me reminisce about the time that I missed my medication, and the repercussions of it from my mother as a young
And you
kid.
must never have missed it again after that.
Oh no, not a chance.
great.
Yeah.
Thanks, Robin, for sharing. Dr. Singh, how do guardians of epileptic patients manage to cope up with the stress generated because of constant fear of seizures?
I think the best way is to be counseled by their doctors. They have to be told by the doctors that epilepsy is not something which is, not controllable. We can escalate the level of care, we can escalate the level of treatment, we can go from simpler treatments to complicated treatments, and we can definitely do something about every single patient with epilepsy to make his quality of life a little better. So, understanding the disease, ensuring the compliance and adequate treatment, these are the three keystones which will help the guardians to, sort of relax and take it easy in terms of their epilepsy. It's also very, very important that we create educational programs, not only for the patients, but also for the guardians and the parents. And this
Absolutely.
is because these things happen, and people always think, if a seizure happens, what will I do? If a seizure happens, what will I do? What will happen if these seizures don't get controlled? So these are natural questions which would come in the mind of every single patient and the guardians. And it would be more in those patients who have a relatively difficult to control epilepsy, because they would have more frequent seizures as compared to those who have a simpler epilepsy, where the frequency of seizures is very, very low. So the lucky ones would have only one seizure or two seizures in their lifetime, but there would be some extremely unlucky people who have 30 to 40 seizures in a single day on multiple medications. So the level of anxiety and the level of depression and the stress is more in people who have chronic epilepsy and difficult to control epilepsy. So there they should understand that they should escalate the level of care. Do not stop at one particular doctor. You If you are not able to get good results from a neurologist, go to an epileptologist, go to a tertiary referral center, go to a person who can manage every single type of epilepsy, like epilepsy surgery is possible. You can go to those centers. There are several dedicated epilepsy centers in the country which are world class actually in India. So escalation of the treatment is also very helpful in understanding and relieving the stress of the guardians.
Thank you, sir, for this informative uh, discussion. Robin, I mean, before this technical glitch, a brief technical glitch, I wanted to ask that how did your mother cope up with the stress of having a child who is suffering from epilepsy?
My mother was a little bit of a lone warrior. In hindsight, I'm certain that she probably would have also liked to have had a more structured support system for her, so that she could, be provide the kind of care that she wanted. For me, it's not that she didn't; she did, but I don't think the knowledge or the practical application of that knowledge was there, or the understanding that a guardian also needs a certain support system to be able to provide the care of a guardian to a patient. But she certainly had a couple of friends that she could fall back on and express herself, because at that point in time, my dad was away traveling with, officiating a lot of matches as far as hockey in his profession was concerned. So he was not there very often. My mother was someone who took care. So in that sense, she could fall back on a couple of friends that I can remember of, and they provided her that avenue to express her concerns, express her possibly frustrations, and things that affected her in as far as caring for me was concerned, so that she could provide that care that she wanted to provide for me. So I think it becomes critical that in a family or in a situation where there is a guardian taking care of a patient, if it's in the family, then that support system is provided to the primary guardian, so that the patient can be taken care of. And there's a team effort kind of built around the guardian, so that the guardian can provide that kind of care. And if it's an individual person taking care of a patient, then to ensure that that guardian has a support system in the form of, say, maybe a friend or a family friend, or a counselor, that they can use and as a sounding board to express themselves, and even kind of possibly figure out solutions that they can offer to the patient. So I think, as much as the guardian is critical in as far as taking care of the patient, I think the health of the guardian also becomes very, very important, and the mental health especially also becomes extremely important, so that they can provide the kind of care that they want to the patient.
Thank you, Robin. Very important message for our audience. By the way, what hobbies do you have apart from cricket, Robin?
Uh, I think a lot of hobbies that I picked up in my life. It's one of my a lot of things and feed my family. Outside of that, I enjoy books, enjoy music. I enjoy other sports as well. Tennis is something that I truly enjoy outside of cricket. But sport, I think, is my first love. I enjoy being outdoors. I enjoy playing. I enjoy competing. I enjoy adding value in a group situation. So that's who I am as a person. So those are the kind of things I enjoy. So even tennis, I enjoy playing singles. I enjoy playing doubles because it's a team environment. You play together to achieve a common goal. I like playing hockey, table tennis, doubles again, more than singles. So yeah, so I'm a team sport kind of guy.
Yeah, thanks. Dr. Singh, a personal question. Do you play cricket or watch cricket? On a scale of 1 to 10, how big a fan are you when it comes to watching an India versus Pakistan match?
I am on a scale of 20. India and Pakistan match is not a match. It is a war.
Right.
It's a war. I, I mean, the amount of adrenaline rush which somebody has in their blood is completely different level when a India Pak match is being played. You can feel that there is a curfew on the roads. People
Absolutely.
don't do anything and just glue themselves to the to the TV screens, and that is so. On a scale of 0 to 10, I am on a 20.
I
I
totally
don't
second
play
you.
cricket. I don't play cricket. I basically am more into photography, sketching, painting. That's my poetry. That's but I love to see
A
cricket.
true artist, Doc.
Great. Yeah, great, sir. So, Robin, have you faced any challenges because of epilepsy as a sportsman and as a human being?
That I should pursue as a young player, as a young kid who's playing cricket. I remember I took a few months off. My parents made me take 6 months off from the game, but they saw that it was not doing me any good. But once the seizures kind of reduced, and they said they can put me back in the sport, and so when I went back to the sport after 6 months, people saw a completely different Robin. So when I stopped playing the game, I was a tall and strong Kurgi boy who stopped playing the game when I was 11 or 12. But when I came back, I was a nice fat round boy who played cricket. So um, yeah, so
Uh,
that's how it was. But we had a discussion about it as a family, and then they felt when they noticed that the seizures were down again, they felt that okay, you can go back to playing, and I'm truly grateful for that because that was one avenue that I was able to express myself as a human being, and I'm glad they didn't take that away from me.
Right. Dr. Singh, what are the common challenges faced by your patients with epilepsy in their day to day lives?
yeah. So the challenges which are of problem to the patients is one is driving. Today commuting is something which is a very important part of your life. So driving is something which is not possible for a patient with epilepsy for at least some time till we are sure that his seizures are well controlled, because it's not only for the safety of the person but it's also for the safety of the public. Because if you throw a seizure while you're driving, you can hit a car, you can have a major accident. So that is one thing which compromises some part of their quality of life. The second is they have to be a little disciplined in terms of sleeping in time, because lack of sleep is one of the most potent triggers for an epileptic attack. So sleeping in time, adequate food, not missing medicines, and avoiding substance abuse like too much of alcohol, smoking, tobacco, and all these drugs which have become sort of a lifestyle these days. So one has to live a little disciplined life. Television has to be watched at a particular distance, not too much of mobiles, not too much of iPads, not too much of computers at a stretch. So if you watch television, it has to be from a distance of about 14 feet or 15 feet. Don't glue yourself to the computer. So these things have to be taken care of. So epilepsy not only requires medication, it also requires a discipline in lifestyle. So that is what sometimes is a problem more for the youngsters, because they want to go out, they want to have a late night, they want to party with friends. And you go to a disco, and those flickering lights, they are a very very potential trigger
Triggers.
for having a seizure attack. So obviously, yes, to some extent the lifestyle is compromised, but it is not that there is anything which a patient with epilepsy cannot do. I mean, Robin is a burning example, and you'll be surprised. Jaunty Rhodes, Ricky Ponting, both were
Mm.
having epilepsy, and there have been people who can do anything if they have an epilepsy. But yes, a disciplined life is very very important.
Right. Thank you so much, sir. Robin, how do you manage epilepsy? Do you follow any particular diet?
So, Dr. Vinay, like I said, I think earlier when I went through epilepsy, it was at a very nascent stage in India, and the knowledge that we had that we have today wasn't available, simply possibly because of the exposure that we had to the illness wasn't as much. So we didn't have that kind of information as far as diets were concerned. We were just like Dr. Singh said. We were asked to make sure that I ate well, and I ate well anyway as a kid. So um, I don't think I suffered from eating well, because a lot of my friends, when I went back to the academy or went back to my cricket camp, refused to recognize me. Like, who's this guy? Come back fat. But what shouldn't be eaten. I've read on multiple platforms that being on a high protein, low carb diet is extremely beneficial for epileptic patients. Possibly even a ketogenic diet is extremely beneficial for epileptic patients. I don't know how far that is true, but it's something that I've read on various platforms in general. And I think going through epilepsy when I in the 90s was a lot more easier than going through epilepsy now, possibly because of the kind of exposure that we have to gadgets and technology and whatnot. Your neurotransmitters in your brain. So there are different aspects that because I haven't gone now, I don't know the care that's necessarily required. But having gone through it at an earlier time in my life, it was far more simpler then. I think, which is why you need that much more support, and with epilepsy as a patient and even as a guardian.
Yeah. Dr. Sumit, would you like to advise our viewers on diet and lifestyle changes a little more, especially the dietary habits and all?
There is nothing which patients cannot eat in epilepsy. Uh, yes, but in general, I would like to say that one has to have a hygienic food to prevent epilepsy from happening. Because in India, a neurocysticercosis, which is the larval stage of abdominal tapeworm, is one of the commonest causes of epilepsy, and this usually is contracted by eating raw vegetables which are not washed properly. And of that, the cabbage, the cabbage is one of the most potent source. So even for the general population, raw food should not be taken. It should be washed properly, it should be cooked properly. That is one thing. The second thing is that in some patients who have extremely resistant type of epilepsy, those who have very very frequent seizures, ketogenic diet in which 80% of your total diet is comprised of fat is of very good um, I must say source, or it's a very good way of helping these patients out, and their seizure frequency actually reduces. But it is not for general population that you go for a ketogenic diet, and it is also not for every epileptic patient to consume a ketogenic diet. So a healthy diet is good, but a ketogenic diet is required for patients with very resistant type of epilepsy. Apart from this, there are no major lifestyle changes. As I've already told you, adequate rest, adequate sleep is important. Taking your medicines in time is important. I've already told about television and exposure to
Mhm.
radiation and radiation screens. uh, Late nights are to be avoided. A little disciplined life might be better for you, and that is it. Otherwise, no special lifestyle changes are required. If you're working in night shifts, that is another question which many people ask me. So if you are doing night shift, then your medical treatment has to be, according to your time of sleep. So it would be that you'll be consuming your medicines in your day, which is actually night. So you'll be consuming your medicines in your wake time rather than time of the day. And then once your night shift is over, you're working in the mornings, and then you have to take an adequate sleep during the day. And it is advisable that those people who are having night shift should be in a room which is relatively darker, and they should be exposed to a dark atmosphere, because that maintains your circadian rhythm and your brain hormones well.
Right. Thank you, Dr. Singh. Robin, medicines have an important role in managing epilepsy. What steps did you take to follow the prescription as dictated by your doctor?
I would say that I played a minimal role, and my mother played the maximal role in that. I was not a big fan of the medication. I'll be honest with you, because I saw the kind of
Nowadays.
impact it had on me physically, and how it made me feel. And I didn't feel good about myself. I didn't feel. I saw myself becoming slower, and I saw myself putting on weight and going becoming from a like a strongish kid to becoming like a really stout and like an overweight kid. And for me, I didn't enjoy that at all. And I don't think if it wasn't for my mom, I don't think I would have continued the medication till I was asked to stop it. So I think my mother played the big chunk of that role, and I owe it all to her in that sense, for keeping me disciplined and for making sure that I took my medication irrespective of what I was doing, where I was, if I was playing, cricket in school, or if I was playing cricket for my state at a junior level. She made sure that the medications were taken. I had to take them. The coach knew, the manager knew, and they had to just keep reminding me to make sure I take it. And I would take them, because I just owed it to my mother in that sense for staying as disciplined as she did. So I think as a kid, she kind of, inculcated that into me by just the whole pressure, I think, of not missing how important the medication was, and not to miss even one day of it. I think the only time, I don't think after that beating I ever missed my medication till I actually stopped. There's a beating I'll remember, even as an old man, I think.
So there comes the role of guardian. Thank you, Robin.
Yes.
Yeah.
Dr. Sumit, what is your advice? What steps can patients take to follow the prescription exactly as dictated by neurologists?
See, people sometimes become paranoid when you tell them to take the medicines and time. Then some people become crazy. Others people are, clubbers. They just forget about taking them. It should not be either ways. So if you have to be taking a medicine twice a day, then 15 minutes, 25 minutes, half an hour on either side of a fixed time is not going to change anything majorly. On the contrary, missing a dose is something which should not happen. So in these days, we all have mobiles, and every single mobile can have an alarm which can be fixed on a daily basis at, say, 6 a.m. in the morning, 10 a.m. in the morning, or 10 p.m. in the night. So you can have these alarm systems. Then there are several apps which are available, which are called as pill reminder apps. So you just download it on your smartphone, and you will be able to get a reminder from that pill reminder that you have to take your medicine. This is the time which is fixed, so you can actually feed your exact timings on that pill reminder, and it's going to give you a buzz that you have to take your medicine now. That is one way. But at the same time, it is also very important to understand that people forget because they want to forget. They have a dislike towards taking medicines, and that is why they feel that it might not be important to take it. Then they also like to experiment. Let me try not taking a medicine for some time, let me see if my epilepsy is controlled. So that is
Mhm.
a very, very wrong part which people
Mhm.
do, and this should be hammered by the doctor into the patient's mind that no, you are not the doctor, I am the doctor, and you will take it as long as I say that you have to take it.
I'd like
Yes.
to add a point here as well, Dr.
Sure.
Vinay. I think
Yeah, sure.
I'm someone who's who's taken medication for epilepsy as a kid. I've even taken medication for depression as an adult. And for me, I think the importance of taking medication, especially when it has to do with your neurotransmitters in your brain, it's something that you cannot mess around with. You have to be extremely careful about deciding to go off it by your own whim or fancy.
Mhm.
I did that as an adult with my depression. I went off my medication by myself thinking I was feeling a lot better, and I experienced the ramifications of it literally weeks into doing that. And it hits you much harder when you go off medications that you started taking for your brain neurotransmitters,
Right.
and then you have to do double the work to overcome all the damage you've done by not taking the medication that you've begun. It's
Right.
important. Like, we cannot take the Indian mindset into. It's not like taking antibiotics.
Mhm.
5 दिन का कोर्स है, 4 दिन कर लिया, 5वां दिन छोड़ दिया. That's not going to fly with medication for your brain and your neurotransmitters. You have to do the whole
Yeah.
course, and these courses go on for years. So the discipline and the patience and the acceptance of the illness needs to happen at a mind level, at a heart level, so that you understand that this is something that's not your fault. Everyone goes through it. It's absolutely fine, whether it's depression or whether it's epilepsy, anything that has to do with the mind, anything that's beyond your control, you have to accept it and say that it's fine. The minute you accept something, it becomes a lot more easier to deal with. And once you deal with that, then you do what you need to do to take action for however long it takes for you to recover from something shows character, and that builds character. So I think there's even sometimes a God-given reason, or whatever people believe in. There's a higher reason for something that we experience in life, and you accept that and take it in your stride and do what you need to do as a human being, as a person, to overcome that, because there is growth involved in that as well. Not just mental, there's emotional growth, there's spiritual growth, there's a lot of growth involved in it. So there's no
Absolutely.
shame in going through anything that's mental. Any illness that's of the mind, of the
Right.
brain or of the brain. You have to accept it, and that'll help you kind of overcome it in a more dignified manner, and you'll overcome it with more confidence. It will not make you feel bad about yourself in any way, shape, or form. So I think that becomes extremely critical, that you don't mess around with medication when it has to do with your brain.
That is perfect
Robin,
advice.
that's a wonderful, wonderful statement. I wish I could record it and play it in my clinic so that patients
Absolutely.
can understand it. It was a very, very robust way of saying things. I'm
So we
very, very
recorded
pleased
this whole
by it.
thing, sir. I'm sure you can take off just that one clip and show it to your patients.
Yeah, yeah.
You'll be,
So,
yeah.
Robin, my next question to you is related to your experience only. I mean, have you ever had feeling of depression or anxiety and felt like giving up everything you had?
Oh
Any
yeah, of
moment in
course.
your life?
Yeah, I have. I've been depressed. I've spoken about it, and I've spoken about it without any shame, because I don't think there's any shame to experience depression as a human being. I've been suicidal. I have come through it. I have gone through it. I've been suicidal for years together. When I've been extremely successful, as a cricketer, when I've earned a lot of money, is when I've been the most depressed. And it's something that it's a very personal thing. That journey happens just with you, and then you have to go through it. But I looked at it as something that I overcame as a human being. It's made me as a better human being. I think I've become more empathetic because of it. I've become more sensitive towards people and what they possibly go through as individuals, as human beings, on a very human level. And for me, there's no shame in going through it. I don't think there's any shame in going through any illness that you go through, you know, because I genuinely believe that there's a higher purpose behind all of it. Sometimes we experience growth, and growth always happens to us outside of our comfort zone. Whether we go to the gym or whether it is life, uh, growth only happens when we experience pain. So if you go to the gym and you train, you feel pain, and then it's only through pain is when the muscles develop and grow and those fibers, break, and then they rebuild and they become stronger. It's the
Very
same thing
true.
in life. It's the same thing in life. Growth never happens inside the comfort zone, always outside of it. So if you have a larger human view about it, and look at it from a broader perspective, you won't be sucked into it. And when you look at a walnut from this distance, it looks like a brain. But if you just take it out and look at it from a distance, it's actually just a walnut. You know. So that's how I think any illness is. If you look at it from a larger perspective of life, it becomes smaller, gives you the strength to deal with it once you accept.
Right. Thanks. Dr. Sumit, research has indicated that there are many psychiatric comorbidity in epileptic patients. Is this true in India as well? What can one do to manage feelings of depression and suicidal thoughts in these patients?
Yes, see, I've already told that we did a research on our own of patients with chronic epilepsy, and we found depression and anxiety in as high as 40% of patients. And this is true to all chronic disorders, whether it is headache, whether it is Parkinson's disease, whether it's a stroke. All brain disorders are long lasting, they take time to correct and cure, and therefore the associated depression is very common. What is important is that there are several anti epileptic drugs which increase the depression. So, if a person is depressed, then he has to be evaluated by a neuropsychologist or a psychologist, see whether there is comorbid depression present or not present. If it is present, then we have to ensure that this guy doesn't get those drugs which increase the depression. And if he has to be on those drugs, then we have to select an antidepressant which does not increase the potential for for the person to have seizures. So it is a double decision which is equally important. So choice of anti-epileptic drug in a depressed patient and the choice of antidepressant in an epileptic patient, both are very, very important.
Thank you, sir. Robin, we had also discussed that Jonty Rhodes, he is also an epileptic patient. Have you ever discussed with him about epilepsy and what all he went through his life?
No, unfortunately, or fortunately, I haven't had the opportunity to discuss that with him. Possibly because it's a very personal topic, and
Yeah, I understand.
when you play cricket, it's not something that just because you play cricket with someone, you have the luxury to ask them things that are personal. You have to be in a personal setting. You have to respect the kind of space that you're in. And I have
Professionally.
interacted with Jonty on a professional level, but not necessarily on a personal level. But perhaps if I do interact with him on a personal level, maybe the conversation may come up.
Right. Dr. Sumit, you have traveled across the globe as an expert. What can we do to create more awareness about epilepsy among people of our country?
I think education, and this education should be a part of the curriculum because
Mhm.
it is so basic in nature that one has to interculcate it right at the level of teaching. It should be that level. See, cardiologists have created such a big awareness about heart diseases that even if a cricket ball hits you on the left side of the chest, you'll first go to a cardiologist to see if you have a heart attack or something. So that type of awareness only comes by educating people. Cardiologists have taken that to a different level completely by organizing public awareness camps, public
Absolutely.
information camps. So similarly, we have to create that type of thing by public information. So social media in a big way, uh, patient education seminars in a big way, But more important is that it should be a constructive media responsibility to tell people about epilepsy.
Robin, on a lighter note, who is your favorite cricketer?
Oh, we'd be here for one more hour.
Two
I
maybe.
have so many. I have so many. So many people have inspired me. So many people still inspire me. For me, I consider myself a student of the game. So I feel like I learn every day with this beautiful game. So for me, it would be so unfair to mention just one name. I'd have to mention like I said, a whole hour we'd have to spend just discussing those names.
Yeah.
So, Dr. Sumit, who is your favorite cricketer? Of course, apart from Robin.
Uh, I have exactly the same answer which Robin has. See, cricket is a game of teamwork. So it has
Yeah.
to be the team which has to be praised, not an individual. Sachin is a fantastic hitter of the ball. So is Robin. There are beautiful bowlers. Harbhajan might not be a very good hitter of the ball, but his spin is fantastic. So if there is a team event, it's the team which has to be praised, not an individual. And so I just cannot name one. I would. I love every single cricketer of my team. That is there, India as it is, and so I will not be able to name a single person. It's
It's
not
very, very
possible, and it's
wise.
unjust. And it's unjust, actually.
Very wise answer, sir. I can understand. So, on a concluding note, what is that one message that you both would like to give to patients with epilepsy and their guardians?
Doc, would you like to go first?
I don't mind. So don't be ashamed of yourself. Don't be ashamed of your kids for a disease which they have not invited. If you have it, investigate it thoroughly, get it treated properly, be compliant with your treatment, be a little more disciplined in life if you have it, and be very, very sure that you can achieve anything being an epileptic patient. There is nothing in the world which you can't do if you have epilepsy.
I would like to
Robin, over to
resonate the
you.
same things. I would like to say that one, don't ever be ashamed of it, whether you're a child or an adult. Especially if you're an adult, own it. Especially if it when it comes to relationships, that level of honesty is important. So if you're going through it, or if you've gone through it, I think it's important to communicate that to the other member if you're in a relationship to the other person involved, because that transparency will help as far as the relationship is also concerned. I also think that there should be no shame attached to it whatsoever. I'm so glad that we're doing something like this. I mean, raising awareness that it's absolutely fine and normal to go through these mental illnesses. It can happen to anyone. It's nobody's fault. It's not your fault. It's nobody's fault. And the fact, I think, also that the guardians need a support system to be able to play the role of a guardian extremely well. So if the guardian can, um, if it's a single guardian, then if that person can create a support system around him or her to provide the kind of support that he or she wants to provide to the patient. But if it's a family, to ensure that the primary guardian is getting the kind of support that they need mentally and emotionally to be able to provide the support to the patient.
Thank you so much on behalf of entire Lupin team. I thank you
Pleasure.
both, Robin and Dr. Sumit, for taking time out of your busy schedule of joining today and sharing your experience and expertise to educate public and to make awareness among them. I
Thanks,
also
Thank
thank
you.
Shan.
StreamYard as our technical partner. And last but not the least, thank you to all audience who have joined us today. Thank you very much.
Thanks,
Thank you.
Robin.